Abnormal uterine bleeding. Your lecturer is Assistant of the Department Yegijanova Gulbashan Mirzahmetovna. The menstrual cycle. The menstrual cycle is a regular natural change that occurs in the female reproductive system, specifically the uterus and ovaries, that makes pregnancy possible. You see the hormone regulation during menstrual cycle. According to the decision of the International Federation of Obstetricians and Gynecologists (FIGO), terms such as dysfunctional bleeding, menorrhagia, metrorrhagia, hypermenorrhea, menorrhagia should be recognized as obsolete and replaced with EMC, abnormal uterine bleeding. FIGO classification of abnormal uterine bleeding, AUB, Palm and Coyne. Structural causes of AGMB, PALM. Polyps, endometrial or cervical, adenomyosis, leiomyoma, submucosal, other, malignancy, and hyperplasia. Non-structural causes of HMB, COEIN, coagulopathy, ovulatory dysfunction, endometrial, primary disorders of the endometrium, iatrogenic, not yet classified. Principles of AUB diagnostics, visualization diagnostic. In AUB, transvaginal ultrasound should be the first diagnostic method of choice, GCH, and diagnostic hyperoscopy should be used to diagnose and describe discrete intrauterine abnormalities such as submucosal fibroids. I2A. Principles of AUB diagnosis, endometrial assessment and biopsy. Endometrial biopsy for bleeding is indicated for women over 40 years of age or in the absence of the effect of medication, as well as for young women with risk factors for endometrial cancer. In office, endometrial biopsy should replace dilation and scraping of the uterine cavity as an initial assessment of the endometrial condition for these women. Biopsy of focal endometrial lesions should be performed under the control of hysteroscopy. Endometrial hyperplasia. The spectrum of morphological alterations from hormonal changes through precancerous disease that characterize the excessive estrogenic effect on the endometrium. Hyperplasia and normal. Principles of AUB treatment, drug therapy. Non-hormonal medications such as SAIDs and antifibrinolytics can be used to treat severe menstrual bleeding that is cyclical or predictable over time. AS, DMPA, and LNG IUD Mirena significantly reduce menstrual bleeding and should be used to treat women with AMC who want to get effective contraception. Clara and Mirena have officially registered with indication treatment of stroke. Cyclical progestins taken in the luteal phase do not effectively reduce blood loss and therefore should not be used as a specific treatment for severe menstrual bleeding. Patients taking GnRH agonists for more than 6 months should receive additional hormonal add-back therapy, unless it has already been prescribed since the start of GnRH agonists. Principles of AMC treatment: surgical treatment. Indications for surgical treatment of women with AUB include inefficiency of drug therapy, inability to use drug therapy due to side effects, contraindications, severe anemia, impact of quality of life, concomitant pathology of the uterus, large uterine fibroids, endometrial hyperplasia, dilatation and scraping except in cases of severe acute bleeding that can be treated with medication, should be classified as a diagnostic technique that is performed if it is not possible to take a sample of the endometrium or perform a hysteroscopy. Non-hysteroscopic methods of endometrial ablation compared with hysteroscopic ablation have a lower risk of complications and greater patient satisfaction with the result of treatment. Hysteroscopy is the final treatment for AUB. Improving a woman's quality of life is the ultimate goal of treatment, which can be achieved by reaching amenorrhea or amenorrhea. Thank you.